Hey everyone, Misty here. Today is August 11th, 2026. It's been a number of days since I've put a video up. Pretty much this whole cycle. I think I did it on day 2 of the cycle, and now my cycle's almost done. It would be something like day 13 or something right now of cycle 5. Today excuse me. Today I go for my pre-treatment to see if I am healthy enough to do chemo on Thursday. For some reason, they have me scheduled a little bit different this week. I had pre-treatment Tuesday and chemo Thursday. Usually it's just the next day, but I've had quite the cough. It's progressively getting worse, so I will try to not aggravate it, I guess, while I'm doing this video. So in the last video, we had traveled I think partway to our destination. We were going down for a birthday celebration for Troy's aunt and uncle, and we did go. I ended up just staying back at the camper. I didn't join any of the festivities. Once my insomnia kind of settled down, I was very exhausted, and I ended up with, I think, the neuropathy pain in my legs, but it was tingling up, way up past my knees, and I could hardly walk for a couple of days. Actually, I've hardly been able. I could hardly walk for a couple of days and very off balance. And I don't know, it was not good. I did walk around once a little bit in the campground, but it was all I could do not to stumble all over the place like, I guess, Jack Sparrows. Is it Jack Sparrows? Sorry, my mind is thinking about so many different things. So, lots of times when I'm away from home, my digestive system gets interrupted and I end up with things not staying regular. So I was having issues with that before we even left, and then I think the accumulation of all these chemos are just making the regularity less regular. Then this new medicine, I think, added to it, and then being away, it was just getting really bad. So by the time we got back to home, I was having a really bad stomach ache. Things weren't moving at all. We ended up, the day after we got home, I went into the clinic to talk to them, and we didn't have a doctor in the clinic that day, so I talked with one of the nurses, and she said I should go to ER and talk to them. So we went and did that, and there's a certain procedure that they have to follow when a person's on chemo like this, so that they can prevent, I guess, exposure to getting more sick, and they need to do a bunch of lab work and stuff to make sure that your immune system hasn't crashed and go into, I guess, worst case, pretty much worst case scenario would be sepsis, blood infection. So they went through all that, and my numbers were really, really weird. I can't remember. I'd have to look them up, but my white blood cells had spiked like from 5 to 25, which is drastic spike, in just over a week, because that had been tested at my pre-treatment. There was a number of things, and I guess the hardest part is that was the first week on this new medicine, so we didn't have any history to know whether or not the new medicine just caused these changes, or if there was something actually going on. And our ER staff isn't really focused on cancer patients, so they don't have, I shouldn't say focused, but that's not their specialty. They specialize in emergent care. So when they come in, they can do what the paperwork says and follow the protocol and stuff like that, but they aren't really that experienced on how to do it. So they were concerned with my white blood cells count being so high, and one of my GPOs happened to be in the hospital when I was in there, so the ER nurse or doctor, I'm not sure which one it was, went and talked to the GPO. That's the local general practitioner of oncology. I almost said the wrong word. And he said, oh yeah, it's normal for it to spike like that. So I don't know if it is or isn't, and I'm not sure. But anyways, then we had staff change. So the ER doctor went home, or finished her shift, and another ER doctor come on. And my main concern for being there is because I thought maybe I had a bowel blockage happening, because there was nothing happening. Everything was just stopped. So they did an x-ray to see, and then they were going to determine from the x-ray if they needed to proceed on to a CT scan. So that got done, and well, I guess before the first ER doctor left, she's like, oh, I'm concerned because your O2 saturation is low. And it was kind of fluctuating in the low 90s. And usually, my understanding is it's a concern if it's sitting below 95. You should always be, a healthy breathing should always be above 95%. So the ER doctor wanted to run another blood test to check for something or other that would indicate whether or not I had a blood clot in my lungs. So got that done, and I don't know if she got the results before she was done her shift, and I don't know if it was in my notes for the next doctor to follow up on it. Nothing was really talked about with that. Sorry if I cough and it's really loud in the mic. I don't mean to. I'm trying not to cough, but and I'm trying to get through this so that it doesn't drag on as long as some of the other videos are. I know they get really boring. So he come in, the second ER doctor, and he was all concerned about my low O2 also. And he wanted to do a CT scan on my lungs. So we went and had that done. Yeah, they did 2 CT scans on my chest. Now I can't remember what the first one was for. But anyways, they did, I had an x-ray and, a CT scan on my abdomen area and then a CT scan on my lungs. And when it come back, the CT scan results, it said that there weren't any blood clots, which were good, but it showed that there was a bunch of hazy broken glass looking thing, I think it said in the report. So he was concerned that I have a lung infection. So he prescribed antibiotics, gave me IV antibiotics that night, and then sent me home with the prescription to start the next day. And I have been short on breath for quite a while. And it's just not getting better. So I am looking forward to seeing what the doctors say today at my pre-treatment. I'll let them look at the scans and see what my blood work says, and if I have to, I'm going to push hard for them to try and figure out what to do, because even sitting here talking is making me cough. I think I probably should have sat and waited for my lungs to fully recover from the last aggravation before I started this video, and maybe I wouldn't cough so much. But for me to go from my bed to the bathroom and back to bed, or from the chair in the living room to the bathroom and back to the chair, is like, I don't know, it's less than 20 feet to the bathroom. I am so winded that it takes 5 minutes for me to stop huffing and puffing, and then it takes a good 15 minutes for me to stop shaking. So I don't know, it's not good. Basically all I do is sit here and hope I don't have to get up for any reason. I mostly have things moving in my digestive system. The scans showed that there weren't any blockages, so they gave me some advice on what to do to get things moving, and I've been working on that. But things are not moving as well as they should be, so I'm still probably not eating enough, and I'm very, very selective on what I eat, mostly just produce and yogurt. But that's not sustainable either. I got to get that going better, but that's not the top priority. It's getting my breathing a little better. But I'm gonna sign off for now, and I have arranged so that my sister can pick me up and take me to my pre-treatment. So I will check back here soon and let you know how it all goes. Thanks for checking in on me. I'll be right back. Hi, so I am back from my pre-treatment appointment, and it was a heck of a lot more involved than all my other ones. Very thankful that my sister could pick me up and drive me, because I'm not in any shape to drive myself there. and I'm still coughing lots. Oh, sorry. That's probably just stressful seeing that. So, all right, let me give this a try again. I'm still huffing and puffing a little bit, so I probably should wait a little bit longer, but it's hard to find the patience to just sit and wait all the time. So, can't remember what I was saying. My sister come and picked me up, and went with me to my pre-treatment appointment. When we got there, a nurse that I had never met before was my nurse for the day. And I'm sure she's great, but one of the nurses that I've chatted with lots and has helped me lots come over, and she's like, "You don't look very good. How are you doing?" And I said, "I'm doing terrible." So I told her what was going on, and she kind of stepped in for the other nurse, and I don't really think the other nurse liked it that much, but this nurse is like, "No, this needs to get looked at." So I'm grateful that she does that. She really advocates for the patients. So she suggested to the doctor that I get a ECG done with all the leads, echocardiogram. So went and got my blood work done. And while I was getting the blood work done, she talked to the doctor about getting the ECG requisition. So when I come back from, actually before I go on with that, the hospital was having issues with their computer system. So when I went to lab, they're like, "Okay, go sit where you normally sit," because there's a different area for, I guess, immunocompromised patients, so that we're not sitting out with, hopefully to prevent us from getting coughed on by another patient in the hospital. But the admin said that there's no way to attach a note to my file that's where I'm at. So if I sit there for a long time and wait, let somebody know that I'm there. So we sat and waited for a long time, and I'm like, I've never waited this long before. So I flagged down one of the people walking by, and she's like, "Oh yeah, come on into room 4. So they weren't busy at that moment, but they just didn't know that I was there because they were having computer system problems. So I got that all done. Went back to the cancer clinic. They did I can't remember if it was before or at what point. Oh yeah, it was after I had my labs done. They did my vitals. And that's when the nurse come over, and she's like, "Yeah, this isn't looking good." So she wanted me to walk around with the O2 on, and she's like, "Yeah, you've taken like 10 steps and your oxygen is just dropping." So she's like, "Go back to the chair slowly and just wait." So got the ECG, echocardiogram requisition, and in the meantime, the GPO decided he also wanted, I guess it was because they got my lab results back too. Maybe it was a combination of things. He wanted an ultrasound of my heart. So this, I don't know, something that totally off the topic of medical, but for, I don't know, the last 10 or 20 years, I don't think it's been 20 years, might be getting close to, I have, on a very, very regular basis, had my file mixed up with another lady in town with the same name, but her last name has a slight different spelling, but it's the same pronunciation. So I don't know, I get this, my GPO goes over and talks to them at ultrasound, and they're like, "Oh yeah, we already have her booked." And he's like, "Oh, okay, well, that's weird." And he thought, well, maybe one of the nurses had gone over there and talked to them. So he comes back and tells me that they can do it right away, so go over there and they'll get it done. And it's like, holy smokes, is this ever working out great? So I go over to the admin for the ultrasound, and she's like, yeah, we have it all set up. The doctor come over and got all ready. So just go around and wait in the waiting room and we'll call you shortly. So I go and do as I'm told, and I'm waiting. I don't know, wait 5 or 10 minutes or something like that. And somebody comes in. I think it was the ultrasound tech. And I was just kind of expecting to be called, so I didn't really listen that close to what she said, and she wasn't super loud. So I just thought she said my name. So I get out, like, yo, yeah, that's me. And I'm just wanting to get feeling better. So I'm happy to just hurry up and go along with her. I get walking down the hall and she's like, what's your name? And I tell her my first and last name. And she's like, what's your birthday? And I tell her my birthday. And she's like, what's your birthday? And I tell her my birthday. And she's like, oh, and she's looking at the chart. And I'm like, oh, did they get the chart mixed up with the other person again? Because like that's how often this happens to me, that it immediately jumps into my mind that there's a mix-up on files. And she's like, well, I don't know. Can I see your care card? So I take out my care card and I show it to her. And she's like, yeah, the birthdays are different. I said, well, she's like, what's going on? I said, oh, they must have just, the doctor come over and talked to admin, and they must have just pulled the wrong chart by accident. So she's like, okay, can I take your care card with you? And I'll see what's going on. So she leaves, and I go back in the waiting room. And I'm telling my sister what happened. My sister's like, oh, was that ever quick? Because I was gone like a minute, maybe 2. And I said, oh, same thing that happens all the time. They got my chart mixed up with the other Misty. And there was another lady in the waiting room, and she's like, my name's Misty too. And I said, oh, well, is your last name such and such? And she's like, yeah. And like I've had so many times where the files were mixed up, but I've never been sitting in the waiting room at the same time as this other lady. So she's like, oh, well, I was actually supposed to have an appointment. And oh, it was such a mix-up. It was such a mix-up. So she hustles out of the waiting room to go find somebody and talk to them because she doesn't want her appointment canceled either. And I don't know, it was just a gong show. It's silly how this happens all the time. So they did get it all straightened out, and they're like, well, the other lady was the one with the appointment, and we thought it was the same person that the doctor was talking about. We didn't realize that there was 2 people trying to have an appointment at the same, 2 people with the same name trying to have an appointment at the same time. So they're like, can you come back tomorrow? And I'm like, no, I can't come back tomorrow. So they were great. They made it work, and they were able to do the ultrasound and everything. And they were very apologetic. And I think they are a bit worried about the name mix-up thing because it's kind of a breach of confidentiality, the privacy breach or whatever. But honestly, at this very moment, I just want to get feeling better. But yeah, it's just so weird how that worked out. So anyways, they managed to fit me in, and we got the ECG results, and nothing seems of extreme concern. We won't have the ultrasound back. If the GPO calls and asks the cardiologist, I think that's who it is, to put a rush on it, maybe he'll have it in a day or 2. But if it's just left to take its own time, like their own normal speed, it'll be like a week and a half before the results are back. So my GPO is going to phone them and just kind of try and sweet talk them into getting it done, hopefully by tomorrow. I'm supposed to go in Thursday for chemo. It would be nice to try and push it to have it ready for tomorrow. And then if it gets delayed till Thursday morning, it's at least still before my chemo appointment. So anyways, we ended up getting everything done, and just there was so much extra walking. I can hardly walk very far at all. Thank goodness my sister's very patient. Everywhere we went, if I had to go do something, I'd come back and I'd have to sit there and catch my breath for a while, and then we would move to the next little area and I'd sit there and I'd catch my breath again, and it's pretty ridiculous. But my GPO is going to contact my oncologist and the cardiologist, and hopefully they can get a conversation in before the chemo when the GPO looks up the typical side effects from the new medicine that I started on my last cycle. This is not a typical side effect. Plus the fact that the labored breathing, the shortness of breath, all that stuff started before this new medicine. He's thinking that it's from one of the first two medicines that I've fully completed now. But a lot of this stuff has a cumulative effect. So even though I'm done doing that, it still could be getting more bothersome. So he doesn't think the new, like my infusion on Thursday will affect this at all. So his plan is, at this point, we're going to follow up tomorrow or Thursday to make sure. But the thought is we will continue with chemo on Thursday, continue with looking into this breathing and cardio, my heart stuff, and just continue as is. And in the meantime, just try to do the best that I can. And if I sit long enough and take it easy, like if I don't know, I could sit here for half an hour, and sometimes it's kind of the coughing and stuff is out of my system. Other times it takes a little longer. I got up and went to the bathroom right before I started this one, and I sat for about 5 minutes trying to catch my breath. And I know starting this video, I was still huffing and puffing a little bit, but I just want to get this video out there. I know it's been many days since one's out, and people are messaging me and asking me how I'm doing. Well, I'm not doing that great. I'm not doing absolutely horrible. In between the huffing and puffing, when I get everything actually settled and not stressed and everything, I, for the most part, feel fine. Walking around today at the hospital, because there was so I would go somewhere and then I would have 5 minutes to kind of recover in my breathing, where I wasn't huffing and puffing, but I didn't get a full recovery. By the time I left there, I was staggering so bad that my sister kept asking me if I wanted her to go get a wheelchair. I think she was worried I was going to fall down. But I don't know, I guess if it comes to a wheelchair, it comes to a wheelchair, but it's just so humbling, I guess. It's a battle in many, many ways. Yeah. And I guess on one hand, it's a little scary that if you take this next step and will that be the way it's going to be from then on? And yeah, I don't know. But anyways, hopefully I get some more information tomorrow, and hopefully it's good information. I sure would like to breathe better, and I would like to just hurry up and get all of this done. One thing that I'm not excited about is delaying the chemo, because if we delay the chemo, the end date is also postponed. And my GPO said, asked me if that was on my mind when I come in, and I'm like, no, I don't want to delay any of it. I just want to hurry up and get it over and done with. Like, I have a kind of an end date in my calendar, and I don't want to extend it. So he's like, okay, that's good. I said, but at the same time, I need to be able to get up and go to the bathroom, and and it would be nice to be able to get up and do more than just grab a yogurt out of the fridge and stuff. I don't know why in these videos I feel like I always have to rub my cue ball, but maybe it's good luck. I don't know. It's kind of weird. But yeah, I'm not doing great, but I'm getting through. I did see my iron numbers. My iron saturation was 5, and that's when they started the iron infusions, and then it come back at 5, and then it come back at 5, and this time it come back at 6, which is good that it's increasing, but it should be over 10, I think, or is it over 12? I'm still very low, and that confuses me too. When I look up low iron, one of the side effects of that is labored breathing. So I don't know. My ferritin, which is your iron storage, is super high now. And when it bumps up like that, the GPO was telling me today that is a marker for inflammation of something else. So it's not like it's, oh, turn to page 73, the answer's right there. It's a whole lot of what the heck can it be, and ruling stuff out. So I don't know. I don't know what to do. I wish it was an easy answer. I kind of had a feeling that the doctor was a little finding it a puzzle today too. But yeah. Anyways, I'm rambling, and I am going to just post what I have and hopefully have a good sleep tonight. I actually slept good last night. Once I get settled and not moving around, my breathing is fine, and then I slept just fine. So yeah, I don't know. Anyways, chat with you all again. See you next time.